Okay, so welcome everyone to this program. Thank you so much, Kerry, for being kind enough to conduct this program for the Indian audience as well. Of course, I know you're quite known in the US audience and the in Mexico and various other countries where you create a lot of awareness around the specific ancient modality, which is about self-massage shiatsu, and basically around the acupressure points. That's all I know. Maybe, once I pass on the control to you, you can just help us understand more about it. But this collaboration for everybody listening here is we have a platform called Yogna, the Ageless, and we are trying to build a platform where we bring in these ancient people in ancient modalities, experts from the ancient modalities from all across the world, and pass on the knowledge from a very ancient knowledge perspective. So this platform is all about reviving the ancient. I think that's the best way I can put across, what we are trying to do. And we've done a previous session with Kerry, which was about on the similar lines, which was more about holistically about acupressure points and self massage. And today's session is an extension to the previous sessions that we did. And if you're really interested in understanding the previous session, it's available on our Swarasya YouTube page. You can just look into that. So the whole idea of this session is we really want to delve deeper into one specific modality, one specific part of the body, combination part of the body, which is the lungs and large intestine, which as per traditional Chinese medicine are complementary organs coming together when it comes to health, and how these two organs work together at the very foundational level. And if large intestine or lungs not functioning well for you, how other diseases start to build on top of it. So these are the foundational organ systems on top of which a lot of health conditions start to build up. So Kerry, I think I'll pass it on to you now to help us understand how these organs are really the foundation for our health and what all we can do to take control of these organs. Over to you, Kerry. Thank you.
Wonderful. Thank you, Deepti. And thank you for putting together these classes and spreading the word throughout India and throughout the world, actually, about more ancient healing techniques, something complementary maybe to allopathic or mainstream medicine. And that's what I teach and have been doing for close to 40 years. And so today, everything, as Deepti mentioned about Chinese medicine, everything I'm going to teach today comes from a Chinese medical background and theory. And so in traditional Chinese medicine, the understanding of the lungs goes beyond seeing the lungs just as a breathing organ. It really encompasses an understanding of the lung function in relationship to the nose, the sinuses, immunity, which we'll talk a lot about today, elimination, and skin-related concerns, and more. And we'll get into the more pretty soon. One of the things that I want to mention before we get going is just a little bit of Chinese medical theory, so you'll kind of understand what we're doing today and where I'm coming from when I'm teaching you this. So in Chinese medicine, there's something called meridians, which are pathways of energy. Meridians are where an acupuncturist would put needles along the meridian lines. There's 14 main meridians that relate to the 10 internal organs. And the theory in Chinese medicine is if the energy is moving through these 14 meridians and 10 internal organs, then things like health imbalances, disease, chronic pain cannot exist. So all of the meridians and the internal organs play a role in determining our overall health. Perhaps none more important than the function of the lungs and large intestine. So Chinese medicine is really different than mainstream or allopathic medicine. It really encompasses more of a synergistic approach to healing. So to strengthen the lung function, it is important to look at how that can be done from a mental, emotional, physical, and even spiritual perspective. And some of that we will touch on today. But just so you know, it's a bigger picture. It's a more of a holistic approach to health. So in Chinese medicine, there's 5 seasons, and each season has a paired organ system, which then has the mental, emotional, physical, and spiritual correlate. And so today we're talking about the paired organ system of the lungs and large intestine. And one of the reasons that Deepti and I decided to do this class first is it's just so important in the time of COVID that we keep our lungs as strong as possible. So we're going to get into all about how the lungs and large intestine works. But first I want to say, most of us have a weak organ system. One of the 10 internal or 5 paired organ systems is going to be weaker than the rest in general. And that's where the work is going to be. For me, my weakest paired organ system is the lungs. And for various reasons, mostly having to do with not making very wise decisions when I was 40 years ago, before I got into all this stuff, my lungs became my weakest organ system. So what that means is that I've spent the last 40 years learning about and teaching very effective ways to keep the lungs as strong as possible. And that's what I want to share with you today. In this half-an-hour webinar today, I want to give you an overview of what I've learned and taught about the lungs and immunity over these last 40 years. So we're going to go into breathing. We'll go a little bit into about diet. We'll talk about self-massage a little bit, and I'm going to demonstrate and teach you some really important things you can do for the lung and large intestine. So that's a little bit of self-massage. And if we have time, we might touch on some emotional aspects of healing related to the lungs and large intestines. So the lung and large intestine works together, and the lungs allow for us to take in purity, and the large intestine is responsible for letting things go. So if what's called chi is energy. So whenever I say chi, just think of energy or prana. From some of you people in India might know prana more than chi. So if the chi in the lungs and large intestine is blocked, then you might experience physical ailments of the lungs and large intestines, such as lowered immunity, that's at the top of the list, bronchitis, shortness of breath, fatigue, mood swings can be there, cloudy thinking, cough, allergies, asthma, all those sort of nasal congestion, emphysema, cold, sore throat, all those things related to the lungs, and the large intestine would be constipation, diarrhea, irritable bowel syndrome, colitis, spastic colon, and abdominal pain. So if any of those things on that list, you feel like that's something that you experience or have experienced, then you're going to want to pay attention so that you don't have that happen again. So first of all, and in the last class, I don't know if any of you were in the last class I taught a few months ago with Deepti on non-surgical facelift. We did an acupressure facelift class, 2 hours long, and we went into detail about how we can look at our faces to diagnose the condition of our internal organs. So Deepti, do you have that chart that we showed last time? It comes from what's called a facial physiognomy perspective. So
yeah,
it's
Kerry,
just
I'll share that.
okay. It's a way we can look at our faces and kind of know where the imbalances are. So if you look at this chart, you can see very specifically the lung area. And in the lung area, right here, if you have anything like, what happens is in the lung and large intestine, both of those meridians support elimination. So if these meridians are clogged or they're not working well, the toxins try to find their way out through the skin, causing dull complexion and sunken cheeks and kind of a lifeless face, dryness, maybe some changes in skin color, and a lack of radiance, and some broken blood vessels. All that stuff can show up in the face, which is indicative of a lung imbalance. There's something that needs some work in the lungs. So what we did in that last class, for those of you that remember or were part of that class, we really wanted to let our spirits shine through our face. So we spent 2 hours working our face and everything else to show how to make that happen. It's something I've been doing for over 35 years. Every day I work my entire body from a self-massage perspective, including my face and my head. And so we taught that, and we looked at the lung area, and then up here in the forehead, you can see where it says large intestine. So if someone has really deep lines coming across horizontally on the forehead, that can be indicative of an intestinal imbalance that's been there for a number of years. The beauty of Chinese medicine is that you can see things and feel things in your body long before they're diagnosable from a Western medical perspective. So what that means is we get to see things that are imbalances that could turn into a disease state, but we also have the ability to adapt that and to change that so that it does not become a disease state. So I just wanted to show you this chart now to see if you can look at your own face and you can see if you have anything in this area or anything up in here that might indicate a lung or large intestine imbalance. Okay, Deepti, you can pull that down if you want. So the first thing we're going to do today, so anyhow, one more thing I'll say about that. So what we did in that non-surgical facelift class is do the diagnosis, we worked our face, but I also talked about an inside-out approach to health. So we can really work on our face and make ourselves look more beautiful. And that's very useful and it actually makes us feel much more alive. For those of you that were in that class or want to get the recording of that class, Deepti is going to put that in the chat and you can watch that in entire class. So what we talked about though is really our health comes from the inside and works its way out. And so from that class, we decided to teach this lung, large intestine class. So it's kind of health from the inside coming out and also from the outside going in. So the first thing I want to teach today is a breathing technique for the lungs. And this is something that that I do every morning. I do a couple different breathing techniques. For today, we're just going to have time to go through one breathing technique. But next week, when I do the larger class, we'll do both breathing techniques. But breathing techniques are really important because they expand the lung capacity and they support us removing toxins from our lungs while also filling the body up with enough oxygen that then strengthens the immune response. So we're getting rid of toxins and then we're building the lung function so that we have stronger immunity. So the one I want to teach you is, so basically what we're going to do, we want to teach our bodies how to exchange carbon dioxide for oxygen automatically. We can do that with conscious breathing, but when you do conscious breathing, I'm hoping that that extends into your daily life and that you start to breathe more naturally and more deeply. So let's start by doing this. We're just going to close our eyes and we'll just take a breath in through our nose to the count of 5. Breathing deeply into the lungs, expanding the lungs. 3, 4, 5. Breathe out through the nose to the count of 7. 3, 4, 5, 6, 7. Hold to the count of 3. 1, 2, 3. Again, breathe in deeply to the count of 5. Expand the lungs. 3, 4, 5. We're going to breathe out to the count of 7. And hold for 3, 2, 3. Breathe in one more time, count of 5, deeply opening up the lungs. And breathe out to the count of 7. 3, 4, 5, 6, 7. And we're going to hold to the count of 3. 2, 3. The next one, we're going to breathe into the count of 5, and then we're going to breathe out to 5, and then we're going to hold to 5. But the thing is, when you're breathing out to the count of 5, I want you to really suck in and contract your belly as deeply as you can. And we're going to hold that for a count of 5. And what that does is it really expels toxins, especially in the lower lung area. So again, we're breathing into the count of 5, deeply expanding the lungs. 3, 4, 5. Breathe out to the count of 5 while you're pulling your belly in, like your belly button's going all the way back to your spine. 3, 4, 5, and hold that for the count of 5. Very good. Breathe into the count of 5, expand your lungs. 3, 4, 5. Breathe out to the count of 5, letting all the air out of your lungs and pulling your belly button back towards your spine, expelling all the toxins out of the lungs. 4, 5. One more time. Breathe into the count of 5. Breathe out to the count of 5, pulling your belly button back to your spine, letting all the air out of your lungs. 4, 5, and hold to the count of 5, really pulling your belly in. Now breathe in through your nose to the count of 5. Open your mouth slightly and breathe out to the count of 7, letting the air come out through your mouth fully. 5, 6, 7. Breathe into the count of 5 through your nose. Open your mouth, and now we're going to breathe out to a count of 10 through the mouth. You can make a noise as you're doing this, as letting the air kind of an ocean sound. 5, 6, 7, 8, 9, 10. Breathe in to the count of 5 through your nose. This time we're going to breathe out to the count of 15 through our open mouth, fully. Breathing out slowly and letting all the air release from our lungs. We can make a sound with our mouth, our open mouth. 8, 9, 10, 11, 12, 13, 14, 15. Okay, very good. Very good. All right, so that is one breathing technique that I would recommend that you do every day and several times a day if you can, because again, we're retraining our bodies to release carbon dioxide and take in oxygen. Because during our days, I don't know about you, but I forget to breathe sometimes. I'm working, I'm doing this, I'm doing that. Unless I am doing a conscious breathing technique, sometimes my breathing can become a little bit shallow. So what I recommend is doing this breath first thing in the morning. This is what I do. I do this breath when I'm lying in bed, first thing in the morning. And then I add on another breath that I'm going to teach next week that I've been doing for 35 years. And we want to do this breath we just did, try to do it 5 times a day. And if you can do it for the next 6 weeks, 5 times a day, first thing in the morning, when you go to bed at night is good, but then 3 times during the day. That is a retraining of how you are breathing naturally. You're starting to breathe a little bit deeper. You're starting to breathe out a little bit more. You're starting to get rid of toxins, and you're starting to really pump up the oxygen level in your lungs. So the next thing I want to teach is a little bit of something called from my self-massage program. By the way, I did develop a 9-session, very comprehensive self-massage program that some of you on the line are part of. Let's see, Phil and Sharon and some other people are part, and Gretchen are all part of that program. So what I do is I break down the different segments and the different organ systems, and I teach people how to do an entire full body breathing or full body workout, working the 14 meridians and the 10 internal organs every day, something I've been doing for over 35 years, almost every day. And I'm almost 70 years old, and I feel a whole lot younger. I know I act much younger, but some people tell me I look younger. So anyhow, part of that program, that self-massage program, is we're going to work the lungs and large intestine. So I'm going to show you a little bit about that today, and then next week we'll go into more detail. So one thing we can do is bring this hand over, make a fist, bring this hand over into this area. And this area is where the beginning of the lung meridian. It's what's called lung 1 and lung 2. And we're going to pound those with our fist Just pound that. And so we're opening up the lungs by doing this very powerful percussive technique. By the way, self-massage predates acupuncture. So thousands of years ago, they were doing this on their body to open up the different organ systems and meridians. Now, if you pound down your arm, see if you can see me, on the thumb side, so pounding down the arm on the thumb side, that's the lung meridian, very important. Turn the hand over, and on the thumb side, we're going to pound up, which is the large intestine meridian. Pounding up, back into lung 1 and lung 2 right here, and pounding down the lung side on the inside is the lung meridian. Turning over and pounding up. And there we go, pounding down one more time, lungs, pounding up, large intestine. Very good. So we're going to just one side today. So after the class, do the other side so you feel kind of balanced. Because of timing, I just want to show you lung meridian is really important. Large intestine is really important. If you go to an acupuncturist, they're going to put needles in the points between your elbow and your fingertips and your knees and your toes. So the points that are furthest away from the internal organs are the most important acupoints. So there's a lot of reasons for that. But what we pounded down today, so this is all lung meridian. And now as we get way down here, away from the lung itself, is something called lung 9. Now, lung 9 is a really important point for pulling energy out of the lungs. If you had any sort of lung congestion, bronchitis, or whatever, an acupuncturist would put a needle right here. It's right at the wrist crease on the thumb side. By the way, this is a very strengthening point for the lungs. It pulls energy out, but also strengthens the lungs. It helps to resolve grief and sadness, which are the emotions of the lungs, which I'm going to talk about in just a minute. So this helps to release. So if you're feeling any sort of imbalance in terms of grief or sadness, this is a really good point. And the way we're going to do it is put our thumb there. We're just going to breathe in and breathe out and push. Again, breathe in, breathe out, and just push into lung 9. And now we're just going to massage it. Just going to massage it. So I just want to show you this point. And by the way, these are points you can work like if you're in a bus or you're riding in a car or you're watching TV. This point and what we just did, pounding down the arms and up, lung, large intestine, and now we're working lung 9. There's other points here I'm going to show you next week that are really important. Because of time today, we're not going to be able to go, we're almost, this time really flies by, doesn't it? We're not going to be able to go into too much detail, but I wanted to show you this, pounding down the arm, and lung 9. Next week, we'll go into some more really important points. There's a point on the large intestine meridian that is probably the top point in the body for immune function. And it's in the top 5 overall points because it does so many great things. And we'll get into that next week. For now, work lung 9 as often as you can. Pound down that arm, both sides, and work lung 9. Really helps to strengthen the lungs and pull out any sort of toxins or any sort of excess in the lungs, any sort of imbalance. I talked about diet a little bit. We won't have time to go into too much detail today, but what I used to do with clients when I saw clients 20 years ago, I would always do a 2-in, 2-out approach. So when they would come to see me, I'd say, okay, I want you for between now and the next session to put 2 things into your diet, and I want you to pull 2 things out and then tell me how you feel. And so what I'm going to mention 2 things. And the 2 things I'd mentioned for the lungs and large intestine, one is green leafy vegetables. Any sort of green leafy vegetables helps to open up the lungs. So that, and then also spices like mustard, turmeric, and ginger And I think those are spices that are pretty, the people from India are pretty familiar with. Is that right, Deepti? Like turmeric and ginger is used a lot.
Yes, Kerry, yeah.
And mustard, all those things open up the lungs. So really, if you're not having those things now, start having those in your diet to open up the lungs. The two things I'd say to get rid of some things you don't want in there, because diet plays such a major role in supporting or adversely affecting lung health. So really sticky mucus causing foods can destroy the soft lung tissues and cause stagnation that could culminate in a weak lung condition over time. So we want to get rid of a couple of things. The two top things on the list for lung health would be dairy and sugar. And so I tend not to have much of either one of those things because I want my lungs to be strong. And I haven't had very much of either of those things for many, many years, decades. And I think it really helps to kind of clear the mucus out. And it's not like you need to do 100%, but if you could even do 80%, that really helps. What I would suggest is trying this dietary thing for just 6 weeks. So putting in those two things, adding those into your diet, getting rid of these two things, and then seeing how you feel at the end of 6 weeks. And I can tell you, you're probably going to feel a lot better overall, but it's also going to reduce a lot of the mucus production that can turn into some problems and some imbalances in the lungs. Someone asked any form of sugar or refined sugar. I would say, like there are things out there like stevia. Has everybody heard of stevia? Those are things that tend to not create mucus in the body. That's a sweetener. It's not a sugar. It's more of a sweetener. That's pretty good. Honey, to some degree. Brown rice syrup is something that can be used as a sweetener. Those things tend to be higher in complex carbohydrates and less in the simple sugar form, which is what creates the mucus. So that would be the answer to that. I would say if you can get rid of any other kinds of sugar, some people think brown sugar is fine. It's not. It's in the same category as white sugar. So you want to be careful with that. And finally, I'm going to end today, before we open this up for any questions. I mentioned the emotional aspect, and next week we're going to do a deep dive into the emotional aspect of sadness and grief. And because those are the emotions of the lungs. So the more we strengthen the lungs, the less apt we are to feel kind of a chronic sadness and grief. So these emotions, by the way, are really appropriate, and their expression is very necessary and healthy, as this is aligned with the free flow of energy throughout the body that I talked about earlier in order for us to achieve optimal health. So if we have sadness and grief, of course, we want to let that come out, and maybe in a sobbing response that comes out of the lungs when, one cries out from the heart due to deep grief. So that's important. But if the feelings and sadness and grief become long-term and chronic and overwhelming, then we want to address this because it will weaken the lung function over time. So next week, we're going to go into a little bit more about that. And we're going to go into some lifestyle tips. We're going to go into some traditional home remedies for the lungs, really easy, simple things you can do every day. But for now, if you can practice a couple of things, those things we talked about today, and I usually tell people it takes 6 weeks for our habits to change and for the cells to start to change in our bodies. So try the breathing, try some of the diet things, and I hope you can come on next week. Deepi's going to talk a little bit about what we're doing next week, next Saturday at the same time in the larger class. But for now, I'm going to check in the chat, or if Deepi, how do you want to handle the questions and answers? Would those just be live, or are people going to ask me
Kerry,
live? Or?
I think maybe people can just message their questions in the chat, because
Okay.
Taking all the questions live may be a little difficult. So whatever questions we get on the chat, maybe we can be online for another 10 to 15 minutes if anybody has any questions around whatever you just taught. And then we can later talk about the program which we'll be doing next week, which is an elaborate form of techniques and strategies that he'll be teaching us in the next
Right.
class, which is the
And
course
for
in
those of you
itself.
that
Yeah.
join next week, I'm going to do more of the self-massage, and it's going to be kind of in a standing position. So you want to make sure you have room around you, because we're going to do a little more in-depth stuff on the lung and large intestine. It's going to require more movement of our bodies outside of a chair. So you can do most of the class next week in a chair, but a little bit of it, we're going to be standing up and moving our bodies around. Someone asked about depression. And is depression on the list? And Deepti, I think you answered that by saying sadness and grief may convert into depression. And that is very true. However, I will also say that the emotions of the liver gallbladder, which is the time of year we're in now, is anger, irritability, impatience, restlessness. We're more apt to feel that this time of year than any other time of the year. And if those are repressed or not balanced or not handled appropriately, those can turn into depression, especially if we're repressing anger. But definitely sadness and grief, a very direct relationship to depression, for sure.
And Kerry, just to add on, like feelings of depression also related to hormones, serotonin, which is the function of the gut, right? And that's how large intestine also gets associated with.
That's very true. Very good point. Yes. Yes, yes. So whatever we do for the lungs and large intestine. Oh, by the way, next week I mentioned large intestine is all about letting go, of course, physically, but there's an emotional and a mental and a spiritual correlation to letting go. And I'm going to about how we let go of things in our lives and how we hang on to things in our lives that no longer serve us. And that definitely has an adverse effect on our overall health, but especially the lungs and large intestine. So next week, I'm going to talk about letting go in our lives, letting go of whatever doesn't serve us. And so we will do that, because I love that. I love that part of Chinese medicine, that it incorporates in all these other things that that takes us in the direction of optimal health, whether that be spiritual, physical, emotional, or mental. So any other questions? Let's see, I'm looking. Deepti, do you see anything else?
Kerry, I guess there are some questions which are like personal questions by mistake. Some people have posted. Let me just check the question.
Let me see.
I have post-COVID residual infection in my bronchioles. I feel no energy.
Okay, so I'm looking, let's see. Okay.
Kerry, I'll repost the question. I'll just repost the question so you can.
Okay, yeah. You're reposting it now?
Yeah.
Oh, okay, see, I have post-residual infection in my bronchioles. Okay, I feel no energy.
Kavita, this is from Kavita, and she's asking, will this massage help me?
Yeah. So I know that feeling. Because I've had some lung issues, and I know that feeling where you just don't have 100% energy because of that. So what I would say is just do what you learned today. Very important. If you can come on next week, it would be really good for you, because we're really going to go into more in depth into how to open up and keep the lung, large intestine chi or prana moving throughout the entire year. And by the way, I want to say one thing about that. As I mentioned, every paired organ system has a time of year. The lung, large intestine time of year is from September 21st to December 21st. So that's when our lung and large intestine function is going to be at its most vulnerable. And that's when we're more apt to get colds and flus and viruses. So that's why you want to start now, really building and strengthening the system. So when it comes around to September 21st, you're strong, you're healthy, you have a strong immune function, which is called Wei Qi in Chinese, so that things cannot enter your body. Okay, yes, I'm interested in the next class. Very good. Deep is going to talk about that. Hello?
Can you talk about the effects of mouth breathing, and if you can tell us about how we can correct the pattern?
I'm sorry, what did you say, Mansi, about what kind of breathing?
Mouth breathing.
Mouth breathing. Well, that just takes a little bit of conscious effort, I think, to be aware. First of all, be aware of it. that you're breathing through your mouth and not through your nose. And that's the first step. And then when you are aware of it, you can do something about it, which means you can close your mouth and breathe through your nose. I do think and actually next week, I'll teach a deeper, really strong breathing technique. And as you do these breathing techniques, at least once a day, preferably 5 if you can, you'll start to automatically breathe more normally and naturally. So that takes a little bit of time, takes a little bit of commitment,
Okay,
takes a little
thank you.
discipline, but
So
it'll
I'm a
help.
physiotherapist, and that is the reason I asked, because people resort to mouth breathing when they have some congestion in their nose, or certain structure. Certain people have a structure that doesn't makes them very difficult to breathe through their nose.
That is true. Yes, there can be some structural mucus kind of stuckness in the nasal passages that mean people breathe. And that just, to me, that just means people need to work on the nasal passages, which is related to the lungs. And once that's opened up, and actually as part of the facial massage that we did, the acupressure facelift, we went into opening up the nasal passages. So you might want to check that out. That's also included in my larger self-massage program, how to work and open up the nasal passages. So someone asked, basic connection between lungs and large intestine, is it letting go? Letting go is a component of it, but breathing in is also a big component. So it's a breathing in through the lungs. The large intestine is all about letting go. And again, we'll get into that more next time. Rebecca said, yes, Bill, ginger. Okay, yes, very good. Ginger and lotus root tea helps to activate the recipe. I think what we're talking about then is things that are good for the lungs. Certainly ginger, and we'll get into this next week. I'm going to get into home remedies and diet and some special teas and all that kind of stuff that you can do for the lungs. But ginger and lotus root are really good. Whatever that was taught today, can that be practiced by a 6-year-old? I see no reason why not. I think it would probably be good. Yeah, for sure. Yeah, why not teach really good habits when they're young? So when they grow up, it's very, very deeply integrated.
Kerry, I would just want to add on here, specifically for whatever you're teaching and talking about here. I guess it's very well applicable for anybody in their early years or in the later years, simply because we are working on the foundations or the basics of what human life rests on, right?
Of what? The last part, Deepti, of what did you say?
So we are talking about the foundations of what human life rests on. I mean, breathing is the fundamental, need of human body. So whether it be a child or an elderly person. So, when you're working on the basic fundamentals of your body, it's equally applicable to a child or to an elderly person.
Right, right. And if you look at a younger child or a baby, how they breathe is very normal and natural and slow and deep. And so they know exactly what their body needs automatically. And so when we grow up and we have all this busyness and all this doing and all this thinking, we forget to breathe. And that's why we need to retrain ourselves. It's really important, Deepti. Thank you. Breathing is an essential component to good health. So, especially for the lungs.
Another
so
question
someone asked,
from someone, yeah.
Someone asked about breathing and writing. So what I can do, I can't do that right now. We don't have time for that, but next week we will go into it again. I will just repeat it. I won't have time to put it in writing, but it's the first step, 3 steps. One is breathing in through the nose to the count of 5, breathing out to 7 through the nose, holding to 3. That's number 1. 5, 7, 3. The second one is breathing into 5, breathing out to 5 as you're pulling your belly back towards the spine. And then you're going to hold that position for 5. Okay. If you can do each one of these sequences 5 times, by the way, that's optimum. The final one is breathing in through the nose to the count of 5. And then we're going to breathe out first to 7 through the mouth. And you can make a noise, breathing out through the count of 7. And then the second one is breathing into 5, breathing out to 10. Third, breathing in 5 through the nose, breathing out through the mouth, making a sound to the count of 15. So those are, I hope you got those notes. We'll go into it a little bit more in depth next week. We're going to add some things on, and we're going to do also another breathing technique. So which two things do we need to remove from our diet? Number one is dairy. If you really want to strengthen the lungs, dairy can really be congesting and mucus producing. Sugar is the other one in all forms. And again, you know, I think a lot of people, when they take on dietary things, they think they, you know, if they think they have to do it the rest of their lives, they're not going to do it. So I generally say 6 weeks and see how you feel. And generally what I found is that people can do something for 6 weeks, they feel so much better, they're just going to continue on their own. So try it for 6 weeks. And Deepti, I know we're going over a little bit. That may be the questions. Do you want to say more about next week?
Yeah, Kerry, before I do that, there's another question. I think we've missed on to that. So somebody asked, I have stomach infection since last 5 months, but there is no improvement even after taking treatment. So what's your take on that?
Well, you know, that's a really big question. And it doesn't come with a simple answer. There's some real complexities to that from a Chinese medical perspective. And you know, there's a lot of things I could say about it, but it would kind of take us out of what we're doing today. And also it's pretty comprehensive. The answer would be, what I would say is do what we're doing today for sure, because each thing feeds the next. So each organ system feeds the next one and they all work together. If I don't know where you live, whoever asked that question, but you might want to visit with a Chinese herbalist, an acupuncturist, and really get some very specific feedback from them, a diagnosis and treatment, and Chinese herbs. I don't know what your treatment is, if it's from an allopathic perspective or not, but if it's not, I would really start incorporating some herbs to build up your immune function and also directly affect the infection itself. I think that's all I'll say about that, because that would be a little bit more complex, but I hope that helps.
Kerry, to add on top of that, I guess it's very important to simplify digestion, because more the load on digestion, more the problem is going to get complicated. So as a first step, of course, going off dairy and sugar is much needed. But apart from that, when it comes to your cooking styles, it should be really simple and easy to digest. So, you know, that gives some space to your digestion to kind of ease out and not have much load for what's getting processed inside.
And that's very good. And you know, and by the way, most of you know this, but Deepti is a nutritional counselor who comes from different perspectives, including macrobiotics, Chinese medicine, and Ayurvedic. So I would suggest maybe talking to Deepti and maybe doing a session or 2 or 3, and because I know she can take you in the right direction if you do not go to see a Chinese medical therapist where you are. One more question. Some people hold their breath often without realizing it due to earlier trauma in their lives, which necessitated heightened hearing. Then later in life, it becomes an auto-stress response, sometimes just when they need to concentrate. It's an auto response over which they have no control. And I understand that. However, I don't necessarily agree that they don't have control, because once people start to recognize the trauma that they have in their body and how that's manifesting physically, that gives them the opportunity to start to break that pattern. It requires awareness first, it requires a lot of support, and it requires just a consciousness that this is what you're doing, and then knowing how to shift out of that. So I do believe past traumas can affect us deeply in our adult lives until we develop an awareness and strategies to start to turn that around. So that's how I would answer that one.
Yeah, thank you, Kerry. I guess we don't have any other questions. So just to add on before we end up the session, what are we planning for the next week program? So before I talk of that, I would really want to share my own experience and whatever is coming along from what Kerry is sharing. How does that make sense? So as Kerry mentioned, like I have been trying to study these ancient modalities from different perspectives, like traditional Chinese medicine, macrobiotics, and Ayurveda, yoga. And one thing that I came across as a part of my 10-year-old study, which is still on, in the ancient modalities, that it's all about prana or chi. I mean, of course, in the modern sense, we do look at it from a very physical perspective, from a very surface level perspective, like what goes on to your skin, or what goes on internally, maybe, in the form of all those imbalances. But what builds these systems that are functioning within us to keep us healthy day in and day out is the energy that is deriving these organ systems. And when we talk of this energy, scientific systems might take a little more time to start believing in this energy system, because energy is something which is not visible. It's a phenomena which you can only feel. You cannot you cannot see it. Something like electricity system, you can see the wires, but you cannot see the energy flowing in those wires. But we still know that energy that flows in those wires does light up our house, does switch on our fan. So there is unseen energy, which in Ayurveda is very well recognized in the by the name of prana. Even in yogic sciences, it's the same concept, recognized as prana. In traditional Chinese, the same concept has been recognized as chi, which Kerry is talking about. And the practices that Kerry teaches, or has been performing on himself also, is as simple as, or as free as, just using your hands and your breath to regulate that energy or chi or prana, to bring about those changes in the body for which you don't, you may be running around pillar to post finding solutions for your health conditions, which you may not even realize are all in your hands if you learn how to regulate your prana or chi. So, basis this, the simple concept of chi and prana, which is completely in your control, is what these sessions we've designed, where when it comes to chi or prana, what is it that actually matters? It's your breath. It's what you do to yourself in terms of your lifestyle and daily practices. It's about the foods which bring in that prana within you, and various other things, which help regulate the prana, is what comprises of as one's lifestyle, you can say. So this is what actually Kerry is trying to do in the next program, where we are picking up one organ pair, which is lungs and large intestine. And similarly, we have, Kerry, if I'm not wrong, we have 5 or 6 different pair organ systems. And
basically 5 paired organ systems. This would be the first. Yes.
Yeah. So this is the first one that we are covering, where we are working on lungs and large intestine. And why this one? Because it's the need of the hour, also considering, we've faced this pandemic. And also because like if you look into Ayurveda mentions that everything, about 96% of your health conditions start to begin in your gut. So we really want to focus on the systems on top of which what starts to build on. Lungs and large intestine, the holding system, and the energy in taking system, which is your lungs, work very collaboratively. If these organ systems are not right, everything else starts to build on top of it. So at the foundational level, if you actually grab these strategies, where you can learn how to, just by using your breath, by doing some massage practices that Kerry would be teaching, and some dietary practices, which again would be a part of the course that we do next week, you can actually build up a very safe system for yourself. It just needs some of your time and a daily practice, and you can actually see within 6 weeks, as Kerry is mentioning, changes happening to you all over your body. And I mean, I can say that personally, since being into it, I have been practicing some of the things on my own. And as I got in touch with Kerry, some of the things that Kerry has been teaching, I have been doing it regularly, specifically the facelift program that Kerry did last time with us. And before that, and rather the 9 series program, Kerry, right, that you have, which also I have been practicing for quite some time, and it's just phenomenal. So, it would be really great if you could just make it for the next session next week. And it's value for money. I mean, apart from that, is also because it's also about you learning to connect with your own self. I guess that's the biggest thing that we lack in these today's times, and that's the reason we've actually left our health, the what do you call, the responsibility of our health in a healthcare practitioner's hands. It's time that we start taking it all in our own hands, which starts with working on your breath or prana or chi, like whatever you call it. So yeah, this is about the program next week that we'll be doing. It's going to be about lungs and large intestine, building a lot of right foundations for your health overall. And so if you would be interested, I will be just sharing the link of where you can register for the program. So we are offering 20% discount on the program, which is going to happen next week. This would be valid for another 24 hours. If you're interested, I would really urge you can just, enroll for the program within 24 hours. And we'll also be sharing a mail with you where you'll be getting all these details in your mailbox also. So yeah, Kerry, that's it from my side. Anything else if you would want to add? Otherwise, I think we can wind up the session.
Okay, Deepti, I'm not seeing it in the in the chat. Did you?
I'm
put it
just
in?
sharing that. Yeah, I'm putting it.
Oh, okay, good. So yeah, as Deepti said, it's $25. It's about a 2-hour long class, very comprehensive. I think you'll be very happy with it. And if you do it in the next 24 hours, it's $20 US. I'm not speaking in Indian currency, but because I don't know how to convert it. So 25
so
US.
it's 1,999 INR, and it's $25, which is the actual cost, but we are offering 20% discount if you use this coupon code Lungs Health on the link which is shared. And for the ones who would really want to go back and again look at the session that Kerry took today, the session will be available on our Swarasya YouTube channel. This recording is going to be available, so you can revisit it and just understand better if you want some time to decide whether you want to attend the next session, and just go through this session again. And for the session that we do next week, which is a 2 hours course, you will be having the recording with you for 30 days, so you can imbibe it and practice it and make it a part of your lifestyle. So,
right. Yeah, very good point. So if you can't make it next week live, the recording will be available to you. If you know other
I'm just
people.
sharing the second, Kerry. I think I.
Oh, there it is. Okay, I see it now. Yeah. Oh, yeah, good. They got the coupon code. Very good. All right. So I hope you all can join for next week. It's going to be a lot of fun. And I think it's going to also be very informative and useful for you ongoingly. So thank you all for being here today. I really appreciate it. I always enjoy teaching, and I'm really looking forward to next week's class, and I really hope to see you then. Okay. Goodbye, everybody.
Thank you, everyone. Thank you, Kerry.
Thanks, Kerry. Bye-bye.
Bye-bye.